A patient's care continues after hospital discharge. Selecting the wrong vehicle for that patient creates immediate physical danger and significant financial liability. Facility coordinators often overprescribe transport. When a patient is medically stable, coordinators sometimes default to calling 911 to request EMS. EMS stands for Emergency Medical Services, which utilizes highly trained paramedics and advanced life support ambulances. Utilizing an ambulance for a non-urgent transport costs thousands of dollars per trip. Because the patient is medically stable, insurance providers routinely deny these claims, leaving the patient with the bill. Simultaneously, this removes an active life support vehicle from the community dispatch pool, delaying response times for actual local emergencies. On the opposite end of the spectrum, families often underprescribe transport to save money. This happens when a patient with mobility impairments is placed into a standard commercial rideshare vehicle or public paratransit bus, where drivers lack the training or equipment to physically transfer them into a seat. Public paratransit relies on shared ride logistics and wide, unpredictable pickup windows. For patients needing dialysis or time-sensitive therapies, these schedules result in missed appointments, they delay critical treatments, and trigger hospital readmissions. This chart shows the core evaluation matrix used to categorize a patient's exact transportation needs. We map this using two primary factors. The x-axis tracks medical stability, ranging from urgent to stable. The y-axis tracks mobility independence, ranging from immobile to fully capable of walking. EMS belongs exclusively in the top left quadrant. It is a specialized service designed strictly for patients who are medically urgent and immobile. The entire right side of this matrix is covered by NEMT. NEMT stands for Non-Emergency Medical Transportation. It is a specialized logistics sector designed specifically for patients who are medically stable, regardless of whether they can walk or are bedbound. Treating a patient's medical transport like a commodity taxi ride ignores their physical reality. Failing to match the vehicle to the patient guarantees either physical liability or financial waste. This flowchart shows the exact decision matrix facility coordinators and families must use to match a patient to the correct NEMT vehicle type. Every decision tree starts with the same question: is the patient medically stable? If the patient is stable and can walk or transfer into a vehicle seat with minimal assistance, they are routed to ambulatory transport. Ambulatory transport is the most cost-effective tier. However, drivers at this tier provide only basic supervision and a steadying hand. They do not provide physical lifting support. Placing a patient in the ambulatory tier when they cannot reliably support their own body weight is a liability risk. If a patient falls while navigating the curb or the vehicle door, the facility can be held accountable. If the patient is stable but cannot safely transfer to a vehicle seat independently, they are routed to the ambulette or wheelchair tier. The ambulette tier requires specialized hardware. These vehicles are equipped with mechanical hydraulic lifts and heavy-duty 4-point securement systems to lock the chair into the chassis of the van. Operating this hardware requires specific training. High-quality NEMT drivers carry a PASS certification. PASS stands for Passenger Assistance, Safety, and Sensitivity, which is a rigorous industry credential developed by the CTTA, or Community Transportation Association of America. PASS-certified drivers are trained to maintain ADA compliance. The ADA is the Americans with Disabilities Act, a federal civil rights law ensuring equal transportation access. Under these regulations, certified drivers are trained to treat a wheelchair or mobility device as a literal extension of the patient's body. Wheelchair more than an ambulatory ride. That premium covers the certified handling and mechanical securement required to mitigate the injuries often caused by manual transfers into standard car seats. There is a final tier condition for patients who are medically stable but physically incapable of sitting upright for the duration of a trip. For bedbound patients or those recovering from major surgery, the required solution is non-emergency stretcher transport. While both allow a patient to lie flat, an NEMT stretcher serves a distinct purpose from an EMS ambulance stretcher. NEMT stretchers transport patients securely, but they do not carry oxygen tanks, defibrillators, or any active life support interventions. The cost of NEMT services across all three of these tiers is validated by a layer of operational quality markers that occur long before a vehicle arrives at a clinic. Legitimate providers isolate vulnerable passengers from individuals with criminal histories. They do this by running strict FCRA-compliant criminal background checks. The FCRA is the Fair Credit Reporting Act, federal legislation that regulates how background information is legally gathered and utilized for employment. Providers are also required to pull ongoing MVRs, or motor vehicle reports, checking multi-state databases to verify a proven, safe driving history. Finally, all drivers undergo strict DOT-aligned drug testing. The DOT is the Department of Transportation, which sets the federal standards for a substance-free workforce. Drivers also maintain mandatory baseline certifications in first aid and CPR readiness. NEMT providers operate as healthcare logistics companies. The vehicle facilitates the trip, but the background checks and safety protocols provide the actual security for the patient. This matrix outlines the scorecard for aligning NEMT tiers against the patient's mobility profile and required assistance level. Facility coordinators operate under a strict mandate. They must audit a patient's exact mobility profile and securement needs prior to discharge. Failing this audit has immediate operational consequences. Dispatching an ambulatory van for someone who cannot walk results in curb rejections by the driver. This leaves the patient stranded, delays hospital bed turnover, and creates immediate liability from dropped patients. For private pay families booking a ride, the mandate is equally strict. Demand proof of past certification and clean background checks before signing an agreement. Families face a direct trade-off. Paying a higher out-of-pocket premium for specialized transport provides professional safety and preserves the dignity of their loved one. Medical transportation is the vital first and last mile of the healthcare journey. A successful clinical outcome can be compromised by an unsafe ride home. Prioritize a patient's physical stability over a cheaper fare. Map their mobility, verify the provider's credentials, and book the exact tier of service that matches the patient's physical reality.